All right, welcome back to ABA exam review and the continuation of our mini mock exam series for the 6th edition BCBA task list. Today we are covering G, behavior change procedures. Highly requested in the comments, and remember, if you have a request, also leave a comment below and we will work through them as we go through our mini mocks. But for obvious reasons, behavior change procedures is very requested by everybody. Right? It's a giant section. It has to do with really the most of the fundamentals of what we're going to be trying to do as BCBAs, which is change behavior. We talk about differential reinforcement and shaping and motivating operations and SDs and all these kind of fundamental ideas that we need to know forwards and backwards, not only to pass the exam, but to be good BCBAs. So we're going to go through 5 questions from G today. We may continue G in our next video, depending on what the comments say. Of course, we're going to keep making these videos, so we will get to your suggestion. Just be patient. Otherwise, please subscribe so you do get all of our mini mock updates, as well as our question videos and our task list series. Work hard, study hard, and let's get going. A behavior analyst is teaching a teenager how to order food at a restaurant. The analyst first explains the steps and demonstrates ordering at the counter, then has the teen practice and provides feedback. Data show the teen can order successfully with the analyst present, but fails to order when at restaurants with parents. What is most likely occurring? Now, in many of the questions in this task list section, you're going to be doing things like evaluating the intervention, understanding what's wrong, maybe what's right, and what's occurring in different situations based on what we're trying to achieve. So in this case, you have an analyst teaching a teenager to order food. The analyst goes through the steps, demonstrates, gives feedback, seems like a good teaching procedure. And then the teen can get to the point where they are ordering with the analyst, but then they can't order with the parents. Now, immediately, you should be predicting some sort of generalization issue, right? Or stimulus control issue. Why? Well, the teen is doing the behavior with the analyst, but is not with the parents. They're not generalizing, and it might be a stimulus control thing. So, with that said, what is most likely occurring? A, instructions were unclear and need to be rewritten. Well, the teenager is able to order successfully with the analyst present, so the instructions seem okay. B, the modeling procedure was ineffective. Again, based on our information, the teen can order, but only with the analyst and not with the parents. C, the skill hasn't generalized, which is expected and requires no intervention. Do we ever just hope for generalization? No, we have to plan for generalization, and we need to intervene and work on generalization. So it leaves us with D, there is a problem with stimulus control. And yes, the behavior is only happening in the presence of the analyst. We need the stimulus control to loosen a bit, so it will also happen with the parents. With all that said, what is most likely occurring? Problem with stimulus control. A client engages in loud vocalizations, an average of 45 times per hour in the classroom, disrupting instruction. A functional assessment indicates the behavior is attention maintained. The analyst implements a procedure where the client receives teacher attention for raising their hand quietly, while loud vocalizations result in no attention from adults. After 4 weeks, hand raising occurs 20 times per hour, and loud vocalizations decrease to 8 per hour. However, the teacher reports that 8 vocalizations still significantly disrupts class. What modification should the analyst consider first? All right, this is a good question. It's challenging. The question says, importantly, what should be considered first? And that's important because there are a lot of different things and paths we can go with an intervention. So when the question is saying what we need to do first, we have to really think hard about that. In this case, the client's engaging in a lot of loud vocalizations. Attention maintained. Analyst has this procedure where teacher attention is given for raising hand quietly. So that's the replacement behavior, while loud vocalizations result in no attention from adults. And notice in these mini mocks, we don't ever jump straight to the answer choices. We reread the question and attack the question. The more time you spend in the question, the easier the answer is going to be. So after 4 weeks, hand raising has dropped to about 20 times. That's great. hand raising has increased, I should say, and loud vocalizations have dropped to 8. Seems pretty good. But remember, we need to be effective, and effective means meaningful change. The teacher says the 8 vocalizations are still significantly disrupting class. That's a big drop. Not good enough according to the teacher. We're not being effective. What should we consider first? A, switch to DRO since DRA is not sufficiently reducing the problem behavior. What's the purpose of DRA versus DRO? With DRA, we can teach a replacement behavior. And with DRO, we're not. And we are trying to teach a replacement here. So going to DRO doesn't make a lot of sense. B, add a punisher for loud vocalization since extinction alone is insufficient. Now, we might be getting close to having to use a punisher, right? It's never our first choice, but obviously it's part of our intervention if needed. C, increase reinforcement density for hand raising and ensure extinction is implemented correctly. So before we jump to punishment, maybe we should target reinforcement and increase the reinforcement and look at fidelity. Is extinction being implemented correctly? D, the intervention is working. No changes are needed since behavior decreased. Behavior did decrease, but remember, we're trying to be effective with meaningful change. The teacher is saying change has not happened enough to where it matters, not the problem. So first step would be looking at reinforcement, looking at fidelity, and then maybe we try for the punishment if this continues. A behavior analyst is teaching a client to request a drink. The client rarely makes requests during teaching sessions despite knowing the correct response. The analyst modifies the procedure by offering salty snacks before sessions and placing the drink in visible reach but just out of arm's length. Within 3 sessions, requesting increases substantially. What did the analyst manipulate? All right, we're looking at what the analyst manipulated here. What did they change? Well, they're trying to teach a client to request a drink. Client rarely makes request. The analyst does what? They offer salty snacks before sessions. Now, why would they do that? Well, if we eat a bunch of salty snacks, we get thirsty. We're trying to increase the value. 2, place drink in visible reach. Why are they doing that? Signaling the drink is available. Given those 2 options, what was manipulated? A, only motivating operations. The salty snacks were manipulating the motivating operation, but we can't forget about placing the drink in visible reach either. That's going to be the SD. Only discriminative stimuli. Again, no, right? Because we also have the manipulation of the MO. So the analyst has manipulated both the motivating operation and discriminative stimuli. They've offered salty snacks to increase the value of the drink, and they've placed a drink in visible reach, which is the SD. Workplace manager implements an interdependent group contingency with a reward as a bonus if collective monthly sales exceed 500K. Individual contributions vary widely. After 3 months, sales increase from 420 to 530K average. However, employee surveys reveal high performers report resentment, low performers report increased stress and anxiety, and social interactions have become tense. What analysis and modification is most appropriate? Okay, let's think about this. What's the problem, right? Because we need to analyze it first and then we'll modify. We have an interdependent group contingency. And what does that mean? It means everybody needs to perform to get the reward. And here, the goal is 500,000. So the whole group needs to get to over 500,000. Individual contributions vary widely, so some people are contributing a lot, some a little. They hit the goal, they get to 530, but then these high performers who are contributing a lot are resenting the low performers, and the low performers are full of stress. And this is the problem with interdependent group contingencies. They can lead to social backlash, right? And they can lead to this sort of situation. Now, analyzing that, what modification would you make? A, the contingency is effective. That's true. Emotional effects are expected and acceptable costs for improved performance. I don't know if acceptable is the right word, right? Is there a better way to go about it without having your entire team suffer from resentment and anxiety? B, consider switching to a hero procedure to reduce resentment and stress. Now, if we switch to a hero procedure, how is that going to help? High performers are just going to continue to resent the low performers who they aren't doing anything. Low performers are going to be full of stress and anxiety because now they feel they're going to let everyone down. So you're probably just going to make it worse. C, consider using an independent group contingency with an altered bonus structure. That's definitely a consideration, right? Maybe everyone is just responsible for their own and you've got an altered bonus structure. D, increase the overall bonus for entire team and keep the intervention. Well, now you've increased the reward. Intervention hadn't changed. That doesn't really do anything except maybe make it worse, right? So B and D might just make things worse, whereas C, we're actually trying something different that might actually alleviate some of these issues. Lauren is shaping longer utterances with a client who currently says juice. The plan requires the client to say want juice to access juice. After 2 weeks, the client only says want juice 20% of the time and shows frustration. What is most likely wrong with this shaping plan? So we have a shaping plan. We're shaping approximations. The client says juice, and now the client is required to say want juice. And it's not effective. It's not going well, right? Client is only saying want juice 20% of the time and is getting frustrated. Well, what might be wrong with this plan? A, criterion jump from 1 to 2 words is too large. Yeah, maybe so. If all they're saying is one word, having them fully say a phrase, want juice, it's a big jump. So it could definitely be a problem. B, the client needs more practice time at this step. Well, it's been 2 weeks and they're not really even getting close and they're frustrated. Okay, might be time to reevaluate. C, shaping is ineffective for language. Use prompting instead. Of course not. Shaping is great for language. And D, the reinforcer juice is insufficient. Doesn't seem to be the case, right? Maybe. But right now, the more parsimonious answer is that criterion jump was just too large. Thanks for watching. Be sure to check out behavioranalyststudy.com for all of our study materials. Leave a comment below for what you would like to see next in our mini mocks. Subscribe for all of our updates. Work hard, study hard. See you soon.